Hi, my name is Sarah Ramsey, and I did my presentation on the top 3 injuries in soccer for college-aged males. Okay, so first up we have ankle sprains. So ankle sprains, there's 2 different kinds. There's inversion, eversion, and high ankle sprains, but for this in particular, we're going to just talk about inversion ankle sprains, since that's the majority and most common. For instance, eversion is only 5 to 10% of ankle sprains altogether. So we're going to look at inversion ankle sprains, which involves the anterior talofibular, posterior talofibular, and calcaneofibular ligaments. My bad. And then there's a great video if you have time to go look at it. So there's usually no skin or bone trauma, usually, but it usually deals with the ligaments, and it's when they have been torn or stretched or internally rotated more so than that they're used to or that they're designed to. So what can this be from? Well, in soccer specifically, it could be the athlete is running on an uneven field and it just internally rotates when it hits a bump or a hole. It could be stopping a ball without much muscle support from the ankle and it twists it. It could be just simply the athlete resting their foot on a ball and it slips off and it just hits the ground funny. It could really be anything, and there's so many different grades. So there's a couple of different ways that you can test whether or not the ankle was sprained. On field, it's best to use the anterior drawer or Taylor tilt tests. As you can see, they test certain ligaments to see if they were injured or, in this case, sprained, even torn in some cases. But in hospital, we can do an x-ray or an MRI to see if there were any bones that were also injured in the injury itself and whether or not the ligaments were torn. And it's also super important to check their range of motion, and by doing that we're also able to see which ligaments, that plus the other tests previously mentioned. So there's 3 different grades, like I said. The first grade is just swelling, tender in a certain area. There's only mild pain. Usually you can weight bear on it just fine. But the joint won't appear loose. There's not usually a whole lot of external besides swelling. Grade 2, there's edema, which is when there's a lot of fluid that builds up. There's tenderness, more so all around over just point tenderness. There's moderate pain. Athlete will have expressed a pop or snap when the injury happened. And weight bearing is painful. It's just, and it can lead later on to arthritis. Grade 3, there's obvious swelling. There's even some external bruising. There's severe pain, and it's discolored, and weight bearing it's possible, but not usually ideal for the athlete. Okay, treatment. So as you can see, for each grade, you're gonna rice, and then depending on the grade, you're gonna do it for different amounts of time. So grade 1, you're only gonna do it for about 2 hours a day, just for a couple of days. For grade 2, you're gonna do it for at least 3, and for grade 3, 3 or more days, especially since grade 3 will often require surgery. With grade 1, you can give it a horseshoe pad or elastic to help give it a little support while it's healing, but it's really not 100% necessary. And then for grade 2, usually you're going to need crutches. The athlete will for 5 to 10 days, and then not move the ankle for 1 to 2 weeks. They want to move the talus as soon as possible, within 48 hours, and they will usually tape it close basket weave when the athlete is starting to walk again. And then in grade 3, like I said, probably required surgery, rice for 3 or more days. It's going to be 3 to 6 weeks, like in a dorsiflex position. And then after that, it'll be taped for 3 to 4 weeks or 3 to 6 weeks, sorry, with crutches. So that one takes a lot longer to heal. Make sure I'm doing okay on time. And I forgot to start my timer. Oh, but it's there. It's fine. It's great. Okay, so exercises for the grade 1. So for most, you really want range of motion. That's super important. It can get really stiff and like hard to move, and it can get super just stuck in the same position. So range of motion is important. Isometrics, really anything to strengthen and stretch those tendons and those muscles. With a grade 1, it's not super serious, so sport-related activities are often incorporated in if they do have physical therapy. Grade 2, you're going to want to do a lot of isometrics, where the foot is immobilized, it just stays there while doing the exercises, kind of like extending the foot or stuff like that. And then later on, you're going to work on range of motion and proprioception and strength and balance activities. With grade 3, you're going to have a cast, and it's going to be isometrics, and it's going to be pretty much the same thing as grade 2 for PT, except it's going to kind of be lengthened as far as like when the patient is ready to do something, and it's going to take longer to heal because it was a more serious injury. Okay, so these are the exercises, okay? I love these, but that's just my opinion. So I have preventative and rehab exercises and the progression for ankle injuries, and then I have the links above for a couple of the exercises if you get a chance to look at it. But I need to keep going because I'm running behind. Okay, hamstrings. Okay, so the hamstrings. The hamstrings are made up of the semitendinosus, semimembranosus, and biceps femoris. The biceps femoris has a long head and a short head. And a hamstring strain is when these have been strained beyond their capacity in some way. So there's a lot of theories of the ways that that can happen. So if you, if your quads and your biceps femoris contract at the same time, that can cause a strain. Or maybe doctors are thinking maybe it's the quick change of a roll from keeping the hip stable, or I think it's the knee, stabling the knee and extending the hip, that causes the strain, or it was extended forcefully, like too fast and too much in an activity. There's some other possibilities listed there, and a great video of a hamstring strain actually happening. So, usually there's no damaged bones, but you can see evidence of bruising depending on the grade. Muscle fibers are torn in this strain. So grade 1 is when the muscle spasms, or it's more so muscle spasming over tearing. There can be some tearing, but it's more so, it feels like a muscle spasm more so. There's going to be stiffness and swelling and soreness in certain areas and tenderness. But grade 2, it's half torn usually, or partial torn. At that point, there's there's some lack of function. There's some function loss, and there's severe pain. And then grade 3 is more than half torn usually, where there's extreme pain, extreme swelling. Sorry, I'm going to sneeze. There's hemorrhage or edema, loss of function, discolored skin, and then you can palpate, which is really cool, to find either a gap in the muscle or a lump in the muscle, which I just think is cool. But, so in soccer, it happens a lot when soccer players will change a direction really quickly, or they will receive a ball and try to shoot at a weird angle, and it could just put a lot of strain on the hamstrings. Oh yes, just a neat fact. Faster recovery time if the injury is in mid-leg versus proximal. Okay, keep going. Okay, so hamstrings. So there's the biceps femoris, like I said, semitendinosus and membranosus. There are some beautiful hamstring tests right there. mostly manually. So this can be done in the field or in the office, and then an MRI can be done if it's a more serious injury to see if surgery is needed or like what exactly was torn or affected. So, like I said before, RICE is always super recommended. So for grade 1, 2, and 3, depending on how bad the injury is, you're going to have to rest or ice or whatever for a different amount of days. So grade 1, you're going to want to give the patient anti-inflammatory, well, the doctor will give the patient anti-inflammatories and painkillers. But as soon as the pain is gone, they can return to normal activity, which is great. Great news. Grade 2, you're going to rice for 1 to 2 days. Same thing, anti-inflammatories, painkillers. Grade 3, it's usually so the last 2 grades, it's when the swelling is gone that the patient can start physical therapy or just activity again, because they're just a little bit more serious. So recovery time is approximately 1 month, which is great because it isn't that long for an injury. We're gonna start with isometrics, and other little things you can do, but isometrics for physical therapy. Yes. Then after that, we move to like light stretching and like jogging and like stationary pedaling and stuff like that. And then we end with isotonic flexion of the hamstrings, such as leg curls when you're starting to get all of that weight back on the leg and get it used to doing its normal things again. Okay, I don't have time to explain all of this, but they're beautiful in my opinion. They're preventative and rehabilitation exercises for hamstring strains, and then there's some links above that I would recommend looking at. I explained 2 of them. Okay, my favorite, anterior cruciate ligament tears. These are also known as ACL tears, and they're actually one of the most horrid injuries a runner can get. Like, I say runner as in sports that require you to run, like soccer or football or anything like that. But ACL tears are either super career-ending or take months and months to recover from. But what is it? Let's talk about that. So when an ACL tears, it's overstretched due to external or internal rotation of the knee. There's a great video there explaining it if you have time. There is no damage to the bones, but the knee will feel unstable. The patient will often feel a pop when it first happens. There's immediate swelling within hours, and just kind of like everything that the knee is supposed to do decreases completely because it's such an important part. Oh yes, so there's swelling and pain, every case, whether in all the grades, which we'll talk about. The injury most commonly happens in non-contact, 80% I think it was, but it's also possible to happen in contact. It happens mostly when the hip is adducted and the tibia will turn and the foot is planted, the contralateral foot. And so it does this weird turn and it's just, terrible. Sorry. Okay. So for soccer players, this can happen when they try to change a direction really quickly or like pass the ball lateral to the body lateral to the body to the side. So that was like an extreme rotation of some kind where it happens in the legs. I'm almost out of time. I have 1 minute. Okay. Oh shoot. Okay. So when this happens, also other things can be injured in the injury. So like other ligaments and other cartilages and such. The origin is there. Assessment, there's the Lutchman's test, I don't know if I'm saying that right, anterior drawer test, pivot shift test, and then you want to test for full range of motion and get an MRI, see if you need surgery, x-rays. So this is the treatment. You're ricing surgery, you're going to have to protect it, you're going to have to stabilize it. There's rehab. 2 years is the goal for a full recovery, but you're going to start with strengthening exercises such as isometrics, and then you're going to start weight bearing about a month in. There's closed kinetic chain actions to prevent injury happening again, and then you work on like Month 4, you start balancing, start jogging, stuff